Very good. Well, whilst people come in, because we all know nobody ever actually arrives exactly at 2:30 for 2:30 seminars, but let's get started anyway. Good afternoon, morning, evening, wherever you are, to everybody. My name is Mark Pearson. I'm Deputy Director for Employment, Labour and Social Affairs at the OECD, and I'd like to welcome you to this webinar organised by the Global Deal. Huge pleasure to be here and have the opportunity to discuss the challenges facing the long-term care sector and how social dialogue can help to address them. For those of you who don't know, I imagine there's some, the Global Deal for Decent Work and Inclusive Growth is a multi-stakeholder partnership with the OECD, the International Labour Organization, ILO, and Sweden as founding partners. Its aim is to promote social dialogue and sound industrial relations as a means of achieving decent work, quality jobs and increased productivity, and fostering more and greater equality and more inclusive growth. This webinar is the first of a series of 4 that we're organising to disseminate some recent work of the Global Deal. So between now and the end of the year, we'll be coming together to discuss human rights due diligence, living wages, and the just transition. So don't forget, please, to register for those if they're of interest to you. But today, we're here to discuss the role of social dialogue in enhancing remuneration and working conditions of long-term care workers, but also to advocate for the legal recognition of their professional status and facilitating the transition into the formal economy for those workers who are working informally. We all know the COVID pandemic underscored the absolutely invaluable role played by long-term care workers in delivering essential care services. But several years after, well, a couple of years after the pandemic has ended, working conditions in long-term care remain poor. It's difficult to attract and retain long-term care workers as a result. And yes, COVID threw the workers into the spotlight briefly, but the long-term challenges really do still remain. And this challenge is going to get bigger and bigger over the coming years because of the challenge of aging. The share of the population age 80 and over is going to double on average across OECD member countries. And to meet this increased demand, we're going to have to increase the size of the long-term care workforce by around 1/3 at least. And it's not just that there are going to be more older people in future. We're also starting from a position of very high rates of unmet need. Only half of all the people aged 65 or more with severe limitations in their activities of daily living are actually receiving formal care in European countries. And that's where long-term care is, of course, the most developed in any parts of the world. It's not surprising, I think, to us or to anybody else that in our OECD's Risks That Matter survey of public opinion, the prospect of not being able to access good quality long-term care services is a real concern amongst the population. Almost 70% of people say that they worry about this. The brief that we're launching today shows that wages and working conditions will have to improve if we're going to attract and retain long-term care workers in the future. We produced a report, the OECD, earlier this year called Beyond Applause, which documented just how poor working conditions in the long-term care sector often are. People being exposed to risks to their physical and mental health, burdensome working times such as night and weekend shifts. And yet, despite the bad working conditions, often very poorly paid. We can't overlook the likelihood that the characteristics of long-term care workers themselves is one of the reasons why predominantly women, very large numbers of foreign-born workers. Draw your own conclusions. Lots of initiatives around about how we can address the problems in the sector, increasing remuneration, fighting gender discrimination, recognizing skills. I can go on and on. But I think the point is, at the heart of this, we think that social dialogue can play a huge role. Indeed, it was one of the conclusions of that report that I mentioned earlier, the Beyond Applause, that social dialogue was a key way of improving the working lives of workers in the sector in a sustainable way. For example, in helping promote the transition to formality, to improving working conditions in the sector, ensuring higher compliance with the standards set in collective agreements. And of course, the issue then becomes, how do we do that? I think increasing the share of long-term care workers covered by collective agreements, for example, by extending those agreements to all long-term care workers, increasing the compliance and enforcement through enhanced labour inspections, clearer information about the content of collective agreements, and supporting the affiliation to unions. I think you've probably heard enough from me. I think it's time now to pass the floor to the experts. So first of all, I'm going to ask Anna Kleiner, the main author of the thematic brief and our lead expert at the OECD on long-term care, to give us an overview of the challenges faced by long-term care workers and some good examples of good practice to address them. And then we'll go on to discuss the vital role that social dialogue can play in improving the rights, compensation, and working conditions of long-term care workers. So, Anna, over to you.
Thank you, Mark. So as Mark mentioned, I will present some of the key findings from the brief, and also some of the challenges, but at the same time, the policy solutions we are seeing. In terms of first, understanding the challenges, Mark has already outlined some of them, but I will just give some more key figures to this to give you a sense of that. First, we've already seen that there's an issue of shortages, current shortages and potential shortages that Mark outlined. So what you can see is that for OECD countries, we have about 50 long-term care workers per 1,000 people age 65 and over. But we have a wide range with countries where this figure is over 100, but quite a few where we have less than 10 workers per 1,000 persons. And what is also striking is that on average, this figure has not changed in the past decade. And what is happening is that the actual numbers of workers are increasing, but because of the reality of population aging, this is actually outpacing the growth in employment in many countries. What we see is that in about half of the countries is either stagnating, or we actually see countries where this ratio is actually declining. Even countries where they're already above average, like Norway and Sweden, we see a decline, but also countries that are below the OECD average, like the US, we see this decline. And as Mark has said, given the challenges of population aging in the next 20, 30 years, we will need, just to even keep this ratio constant, an increase of between a third or 40%. And for some countries, this is already a low start, so they would need to even go beyond this current ratio. Now, in terms of the poor working conditions, one of the key issues is the issue of low pay. Looking across countries, we see that on average, workers in the sector earn 20% less than the actual average wage in the economy. And this is in contrast to the healthcare sector. So the similar professions, but they're actually in the healthcare sector, where they're actually earning over the wage, the average wage. And this compounds, the low hourly pay also compounds with a low number of hours to really have very low take-home pay, because there's a very high rate of part-time workers, which is twice the average of the OECD rate. We have 32% who are part-time workers in the sector versus 16% sorry, 24% in health and 16% in the average economy. The retention, as mentioned, is low. We see the average tenure in the sector is 2 years lower than the overall workforce. And there's a high likelihood of difficult conditions also driven by shift work, night work, also working on Sundays. We have about 70% who are actually working on shifts, 36% who are working at night. And we have a very high rate of sickness, absence, and accidents in the sector. 75% experience physical risk factors, often driven by having to lift people and having musculoskeletal disorders, but they also have issues of mental well-being. 2/3 of them have such challenges, sometimes driven by time pressure, but also even violence or aggression from the people they care for because they have conditions such as dementia. As Mark has already outlined, we also see a very feminized sector. 90% are women. And because of the working conditions, this has implications for the overall gender equality. But we also see a high rate of migrant workers. More than 20% are migrant workers. And this is, again, also higher than the average in the economy. And even though institutional care, so in nursing homes, is more predominant, we see that the fraction working at home is very important, 40% of them. And this combination of also having the home care and the migrant workers also makes that in some countries we see this rate of underdeclaration. We have countries like Italy, where it's estimated that more than 1 million workers are actually undeclared, or their hours are undeclared. And this is one country, and we see many other examples in countries that are often overlooked. And we also see recent migration patterns are also having an effect in a number of countries. We're seeing people coming from the Ukraine crisis also working in the sector, often, as mentioned, in undeclared conditions. But we should not forget that in addition to the formal and the undeclared workers, the informal, there's also a very large share of what are called the family carers. In fact, Mark has mentioned that a number of people are not getting care, and very few are getting formal care because the bulk are actually receiving either a combination of formal and family care or only family care. And we see, again, very large discrepancies across countries where most of the care is actually provided with family care. And this has enormous implications also, again, for the gender equality, for the workforce perspective of people having to leave the labor market because of that. But also it raises the question here as well of is this sustainable as we have more people wanting to join the labor force, increase women's participation? How is this going to be sustainable in countries that don't have enough formal workers? So I will just give a few ideas of what countries are doing in terms of retaining workforce by improving their conditions. The first one is in terms of improving working conditions. As has been discussed, wages are low in the sector, and there's really a need to ensure decent wages. And we have a number of initiatives happening before and after the COVID crisis. For instance, within this idea of the social dialogue, in New Zealand, there was an initiative really coming from the trade union on the basis of gender equality that won a case and managed to raise wages in the entire sector. But there are also issues sometimes with these initiatives in terms of if hourly wages are increased, but then providers are paying less hours, how can we still make sure that wages are sufficient? And this also raises the broader question of collective bargaining, because there was a big discussion in Germany about, again, increasing wages and this being covered by the insurance. But a number of providers are not covered by collective agreements. So how can this be ensured that we can apply? There's also the issue that we've discussed of informality and promoting the use of contracts. And here we have a number of countries like the US, where there's been an initiative also to cover and extend minimum wages and the same conditions of the Fair Labor Act to workers in the home care sector, which was not the case prior to 2015. But as we've also mentioned, given the rate of health problems and the part-time, there's also an issue of going beyond wages, of initiatives needed to allow choice in work schedules, but also increase safety at work. So in terms of having training programs for safety. And the other issue is how can we ensure that there's enough care quality by providing training. Often workers in the sector are considered as not skilled, but they also face challenging conditions. As I mentioned, people who have dementia, having to coordinate care. So there's a need to rethink the initial training, but also to make training more people-centered. And there's a very recent initiative in the EU to promote this and also make better use of digital skills and digital technology. But there's a need to provide career perspective. So modular training so that people can move from being a carer to being a nurse is important. And there are a number of countries like Denmark or the Netherlands that are promoting this. And again, for a number of people, they don't necessarily have formal training, but they have a lot of experience. So there are also examples of interesting initiatives, like in Spain, where they've initiated prior recognition so that people can be credited for those. And finally, there's also a need to allow for work schedules to improve on the job training, because often providers say it's very difficult to have training because we work in shifts and we cannot do. But there's, again, a very recent initiative in Sweden where they use long-term care unemployed to replace the workers. So the workers went on training and then people were trained on the job to also increase the supply of long-term care workers. As it was discussed before, there's also a very, very big issue of informality in the sector. And here, a lot can be learned from what has happened for domestic workers more broadly. And there are a number of initiatives that cover long-term care workers. And one of the big challenges here is how can we ensure that particularly in the home sector, if employers are families, that there are associations representing them, that solutions can be found. But we have the example of Argentina, where a tripartite commission was built, and there were agreements for improving wages and working conditions that cover also long-term care workers. And the very interesting example of France, where there's the use of the voucher scheme that is broadly used for domestic work, also including long-term care workers. However, there's also a discussion that this also brings financial implications, as it's also a very expensive voucher system, and there's an issue of progressivity, as it's mostly used by high-income families. And finally, as I also mentioned, there's the importance of the family caregivers. And here, there are a number of measures that can be used to support caregivers in terms of ensuring that they have paid or unpaid leave, that they have sufficient training to also do the care, and sometimes having a financial compensation in the form of cash benefits, but also the respite care so that they can take a break and have their loved one cared by a worker. And here, there are also very interesting initiatives coming from the social dialogue side in terms of both training, but also paid leave, but the broader awareness. So for instance, in the UK, there's really an initiative to raise awareness about the burden of people who are both caring and working. There's even a forum of employers who have good practices for this, and this is advertised. In France, there's also a system of people who can donate their leave, because not everybody needs to use this leave, but they can donate it to other employees who can then have more leave available. And there's an interesting initiative also in Ireland, recognizing that a lot of the skills that people have learned as family carers can be transferable. So helping people to use that for their job search and think about their career development. So I will stop here. As Mark has mentioned, you can read more about the broader topic on the report Beyond Applause, but also on family carers on our working paper. Thank you.
Thank you very much, Anna, for the great overview of the thematic brief. So I'm very happy. I'm Glenda, I'm the head of the Global DL Support Unit, and I'm delighted to be moderating a panel discussion now with the key players representing some of the main stakeholders in the area of long-term care. And the idea is really that we hear whether the findings of the thematic brief that Anna has just introduced, whether they resonate with their institutions, what are the key challenges, what are the concrete actions that they are taking or they feel that should be taken. So without further ado, let me introduce the panel. So let me start with Mark Bergfeld, who is Director of Property Services and Unicare at Uniglobal Europe. Hello, Mark. Then we have Aurélie Decker, who is Director of the European Federation of Services to Individuals. Hello, Aurélie. Then we have Youssef Gellab, who is head of the Social Dialogue and Tripartitism Unit of the Governance and Tripartitism Department at the ILO, the International Labour Organization. And last but not least, Stacy Yegemonos, who is Director of Eurocarers. So welcome, everybody. Let me start with first a general question to all of you. As I said, we're interested in hearing whether the findings of the thematic brief resonate with you, whether we've left, feel free to highlight anything that we've left out that you think, we should be discussing today, that you want to bring to the table. And I would like to start with Youssef, please. Youssef, the floor is yours.
Yeah, thank you very much, Glenda, and good afternoon, good day to all of you. And first of all, let me thank the Global Deal for this initiative and for this webinar, and also for inviting the ILO, giving us the opportunity to take part in this discussion around the policy brief that was released not a long time ago. Well, I think that we are discussing here an important, policy area, namely the working conditions in terms of employment of long-term care workers, and how these workers' working conditions, terms of employment are managed at the different countries. And even though I think the brief focused more on the development world, clearly I think the findings are also, I think, pertinent and interesting for other parts of the world, including countries in the so-called global south. I think that we come back to this issue later, in the sense that I think what we have heard from the colleague from the OECD, when she outlined the main findings of the study and showing how this category of workers are facing a number of challenges. I'd like to list a few of them, facing low pay compared to the average categories of workers. Also, I think facing difficult working conditions. Many of them work in night shift, and that sometimes is reflected also in the number of absences and also accident. And what is striking also is not only they work in a difficult sort of complex working conditions, but they are also facing violence and aggression. So it's, on top of that, they face this very serious factors. And of course, we heard a lot about that the how high is the proportion of women in this sector, and also the importance of the proportion of migrant workers, and which are also facing the challenge of undeclared work and informality. So I see there as sort of a whole set of challenges and problems, and that are I think on the table to be dealt with by policymakers, but also international organizations and also the social partners. So this is, I think, an important and I think thematic and subject matter that is on the agenda of not only policy making but also dialogue, because we are also open about social dialogue.
Thank you very much, Youssef. Yes, absolutely, very good point. I mean, we need to raise awareness for this topic and put more emphasis on it. Mark, do you want to go next?
Yeah, thank you first and foremost for inviting Uni Care to be part of this discussion. I think it is a very timely discussion, given that we've seen across the Atlantic in the United States, Biden's investment plan, and which plays a particular focus on investing into care. And then last year in 2022, we saw the European Commission following suit with its European Care Strategy. And I think what all of these initiatives have in common is effectively that more and more emphasis is being placed on what should the workforce of the future look like? How do we ensure that the workforce is treated appropriately and with dignity? And how do we embed trade unions and collective bargaining into that discussion? Because we know that that wages in the sector, as also pointed out in this brief, as well as collective bargaining lag behind. I think what the brief does very well is it focuses on a growing segment of long-term care, namely care in the community and home care. And I think we need to pay attention to how we develop collective bargaining structures in the home care sector. So at the European level, we have joined a project and cooperation with EFSI, with Aurélie Decker from EFSI, amongst others, to advance collective bargaining and social dialogue in the home care sector. But as well as we see that more and more collective agreements are being expanded from the residential care sector to the home care sector, or being expanded from cleaning or other ancillary services into the home care sector. And I think this comes down to a very important political statement: is we really need to ensure as societies across the global north and the global south that we don't have first class, second class, and third class caregivers. Because it cannot be that those working in public institutions, in residential facilities, have better working conditions than those doing practically the same job in a home care setting, or vice versa, or depending on whether they work for a nonprofit organization or for a charitable organization or for a for-profit employer. And I think this is one element that the brief doesn't address, but to be honest, it's called a brief, right? So we shouldn't, expect a lot. And the OECD, with its Beyond Applause, has already, produced very substantive research. So I think we can address the missing puzzle pieces in this discussion, and hopefully within the next few years, we will dig deeper into collective bargaining in residential care, in particular, is one of the topics we're concerned with. We're also concerned with the shift to home care and care in the community, and what trade union access looks like, within that. And then ultimately, we also are interested in the question that Anna pointed to, namely how you tie public money to decent working conditions. And that's particularly important, the case example you mentioned in Germany, but as well as more money comes into the sector, how do we ensure decent working conditions and collective bargaining as a precondition? Thank you.
Thank you very much, Mark. A very good point. I will return to some of these points a bit later in the discussion. I'd like to give the floor now to Aurélie for the same, a general assessment of whether the findings of the brief resonate with your objectives and priorities at FC.
Thank you very much, Glenda. Thank you for inviting us. So FC being a European level trade and employer association in domestic and home care, of course, we work a lot on those topics. I would say that from our point of view, the brief set the scenes very appropriately. And I also share Mark's concerns when it comes to making sure that home care workers are not second-class care workers. We have issued several joint statements about that during the COVID crisis, also during the discussion surrounding the European care strategy, and this is really important. What I will add is that for me, one piece is missing in the brief when it comes to how to organize social partners in the long-term care sectors, or what are these specific challenges. I think it's important to stress that we are in a sector with different employment models that do coexist all together. We have home care workers directly employed by families. We have home care workers which are employed by providers organizations, be they for-profit, not-for-profit, etc. We also have more and more home care workers working as self-employed. So that, of course, raises some additional challenges when it comes to organizing the sectors. And I'm speaking from the employer side. That makes things a bit more difficult. Most of the times, the families, the private individuals who employ care workers do not perceive themselves as an employer. They're just answering a need they do have in the way, the most appropriate way, I would say. So this is one difficulty. The other thing is that many providers in the sector are small, are SMEs, are small size. So it's difficult for them to get organized or to have the resources to, take part in more structured discussion with trade unions and to social dialogue. So that was one aspect I wanted to highlight. The second thing is that during the pandemic, our sector has given has given importance in public debates. Suddenly we were identified, we were seen. That doesn't mean that we received the support the workers deserved in that time, but we had lots of promises. Many promises were made from different states. But if we look at the situation right now, most, and I'm talking mainly about European states, most European states remain unprepared to face the aging population challenges that is ahead of us. We know that the demand for home care will increase exponentially, but still the shift that the political and social priority shifts that was needed has not occurred yet, and we can see it in the discussion that our members have at national level when it comes to budget or the expected reforms for support for elderly people.
Thank you very much, Aurélie. Thank you again. You raised a very, very good points, particularly the the challenge, well, of course, that a lot of the promises are still not being fulfilled, but also the point about the challenge about how do we mobilize social dialogue in a context where the representation of both the employer side and the provider side are challenging for the various reasons that you mentioned. And I want to move to Stacy, who represents a bit of a different sector in a way. So you represent family carers. So Stacy, I think they are mentioned. There's a section in the thematic review, and Anna has highlighted some key issues related to the support the family carers want. But does what we have included resonate with you? What have we left out?
Thank you, Glenda, and hello, everyone. I must say I was not surprised to see informal carers or family carers included in the brief. I was a bit surprised to be invited to contribute to a discussion on social dialogue, given that obviously we represent an unpaid or primarily unpaid workforce. Having said that, I think it's really interesting to have the perspective of informal carers as part of the discussion. And again, I thank you very much for inviting us, because as Anna highlighted in her presentation, the bulk of all long-term care in Europe today is currently provided by unpaid informal carers. I'm sorry for the if that creates confusion. We tend to call them informal carers. So when I say informal carers, think family carers. So yeah, I think the brief nicely encapsulates certainly the key elements of long-term care, the key challenges and questions facing the sector, including informal carers. But as Mark mentioned, obviously a brief is only a brief. So I was glad to see the emphasis, for example, on the importance of work-life balance options for family carers in the form essentially of care leaves and flexible working conditions. And obviously a few years ago, we did manage to include these aspects as part of a work-life balance directive at EU level. But if I may, I'd like to draw your attention to a few additional points which are not necessarily captured by the brief and still deserve attention. Now, based on the best official data at our disposal, which is included in the UK strategy, at least 52 million Europeans of working age are currently involved in the provision of informal care on a weekly basis. So that's more than 14% of the EU population. And we know this is a conservative figure. I'm not gonna have time to enter the details of this, but just, based on the fact that it only focuses on people of working age, but obviously the population goes beyond that group. Now, most of these people, you may be surprised to hear, are in employment as well. So they combine caregiving responsibilities with professional responsibilities. So as can be expected, their labor participation is also related to the intensity of the care they provide. So what we see generally is that on average, 64% of informal carers of working age do work compared to 67% of the overall population. So no big differences there. But for example, the number of, or the group of informal carers who provide more than 40 hours per week of informal care, obviously that figure drops to 35%. So trying to put measures in place to allow these people who combine professional caregiving responsibilities to do that, effectively and in a comfortable manner, that's extremely important, obviously, if we want to maintain their ability to have a productive life, so to speak. Now, the gender dimension of this phenomenon is obviously extremely strong. So it's essentially women who are involved in provision of informal care. And so, as I said, access to care leaves, flexible working conditions, that's captured in the brief, and that's great. But we should be a bit more ambitious, I think. And as I was preparing for this meeting, I came across a very interesting report that we often use in our work, which was published by the ILO in 2015. So, it's perfect. And the report, I think it's entitled Closing the Gender Gap, focuses on the 4 key elements, social policy arrangements that are required to not only support informal carers, but also to boost women's participation on the labor market. The first one is, and it should be, underlined, the best support measure is the availability of affordable and good quality professional care services. So alternatives to informal care, because in many cases, the prevalence of informal care is really driven by the lack of alternatives. So that's an important point. The second point is about the care leaves. So that's captured in the brief, but paid care leaves. And not only paid, but paid at a high enough level, to enable the higher earner in the household, in many cases still men, to take the leave, not just women. So the paid element of the carer leave is really important. The third one is flexible working conditions, but that's included in the Work-Life Balance Directive, but in the non-legislative section, which means that it belongs to the sector or to the company itself to decide whether or not they want to put that in place. And finally, the need to put in place the possibility of care credits. So the possibility to take into account the time spent caregiving, in the provision of care in the calculation of pension credits. And this is a topic which is not captured by the brief, but that's also a topic which is largely underexplored at national level. So these are a few aspects that I think also deserve attention. So I'll stop there for now. Thank you.
Thank you, Stacey. Excellent points. Thank you very much for highlighting what, as you say, we haven't been able to cover in the brief. Now, let me go back to each one of you with some additional questions. Mark, if I start with you, I think you've already mentioned a little bit this, the fact that there is a bit of a differentiation in how we legislate, support, negotiate on long-term care provided in residential homes and the long-term care provided in the family. Are there any, and this creates, as you were saying, differential treatment. So are there any good examples of how we can try and narrow that difference? Have countries or social partners in some countries already managed to achieve that more or less differential treatment between the two groups or other groups, as you were saying before?
I think this is a really important question as we see home care and care in the community growing. I think that one of the important examples that we have comes, for example, from Austria, where if care is provided by companies or nonprofit organizations in persons' homes, the collective agreements that exist in residential care are then extended to people's households. So that is a very good mechanism by which employers and trade unions actually ensure that households don't become somehow a sphere in which rights do not apply. But as your brief also mentions, there's other issues in Austria that need to be accounted for: the high levels of self-employment, for example, live-in care, and the situations that brings forth, etc. Another example, actually, that we see is that at the European level in particular, and I think the European Care Strategy by the European Commission put a lot of emphasis on strengthening social dialogue and strengthening collective bargaining. We see that on the one hand, for the residential care part, we see the establishment of a new sectoral social dialogue in social services, which covers part of the sector, and in which UNI is also involved, together with our sister union from the public services. And then also on the home care part, we together with EFSI and Aurélie Decker are trying to build the capacity of both employers' organizations as well as trade unions in the home care sector, so that we can enhance collective bargaining. One mechanism that we're looking into particular is setting up sectoral observatories. I think those can bring together different stakeholders, because I think that organizations such as Stacey's, Eurocares, and those also have an interest in decent working conditions and good working conditions for care. And we also see that there's other families and patient and users organizations also have an interest in that. And so we're going to try to bring together the authorities, care users, different providers of services, as well as unions in those sectoral observatories at the beginning, in order to lay a foundation for collective bargaining systems where they don't exist. And then lastly, at the global level, and I think we're talking here about the global deal, I think one important step has been that we have a global agreement with a company now that provides residential care solutions. And so ensuring that the companies and employers that are acting at a multinational level also commit themselves to the fundamental principles of the ILO on the one hand, freedom of association, collective bargaining, and also guarantee trade union access rights, and commit themselves to ensuring good and decent work in the care sector, in particular when it comes to part-time contracts, precarious contracts, part-time work, etc. So I think those, if you scale it up, I think you become aware of some of the strategies that we as unions are following through on.
Thank you, Mark. Excellent points. Thank you very much. And I think this is a good point to ask Aurélie an additional question. I think, Aurélie, you are pointing to something very important that even resonated with myself, which is, you know, as a family, you don't see yourself as an employer, right? You're buying a service, you need help, childcare or long-term care. You don't see yourself as an employee. And I know, Aurélie, that you are organizing support for employers, but also for providers in the context of long-term care. And I wanted for you to tell us a little bit more of the capacity building that you're organizing.
Yes, sure. So as Mark mentioned, we have launched this capacity building project at European level last July. So in fact, within EFSI, this is something that we have been doing for several years, but not in a very structured way. So helping national actors to get better organized, to get in touch with trade unions, and to launch a dialogue. But with this new project, we have several initiatives which are planned. We are starting now with a mapping exercise. So we start by identifying all stakeholders at national levels who are involved in the sectors. We are involved in creating and promoting better working conditions in the sector. So that's the first. And then we will issue several reports, and we will launch the sectoral observatories at national level, as Mark mentioned. And from an employer's perspective, we are also working on a toolkit. So how can we help national organizations to reinforce their own capacity and to know how to engage in a structured dialogue with trade unions and the state too, because we should not forget that when it comes to improving the working condition in our sector, we need at some point to involve public authorities in the discussion because they play a major role in it. So we are working on this toolkit, and well, we hope that we will, have at least some countries to progress in the good direction in the month and years to come.
Thank you, Aurélie. And I have another question for you since I have you here, and something that we haven't discussed so much so far, but Anna pointed it out in her presentation, and it's the relatively large rate of undeclared work in the profession. She was giving this striking figure for Italy of 1 million long-term care workers being undeclared or with having undeclared hours. And so I wanted to hear your perspective on this. How can we support a transition to formality for these workers? What's the role of social dialogue in that?
So yeah, for sure, undeclared work is a major challenge for us and for the sectors. My first answer would be that we need a comprehensive policy response to undeclared work. We need some, I call compliance-oriented measures. So we need to help people and to help workers to move into formality, and really not apply any sanctions, but really like in putting incentive for a formalized working relationship in the sectors. The main tool, one of the main tools would be to make formal provision of long-term care services affordable to all. Because, I mean, if undeclared work exists, it's not because people do not want to purchase services, acquire the services on the formal market. It's just because it's too expensive. So they have a need, they need to meet them, and the only solution that they can afford is unfortunately undeclared work. So we need those. We have many kind of incentive. That could be tax incentive, that could be direct subsidies. I mean, each state have implemented its own, but that's not sufficient. We believe that for those tax incentives to be effective and to reach their goal, we also need to have the implementation of good working conditions that go through social dialogue and social partners discussion. It goes also with professionalization, with incentive to career path to the sector. So it's really a package. We have seen some countries which, in fact, if I take the example of Germany for domestic work, they have launched these mini jump schemes more than 15 years ago, which in fact only take into account the point of view of users in formalizing the relationship between the domestic workers and themselves, but it doesn't grant workers the rights they deserve. So it's really a package. We should make the sector access to the services affordable, but we should ensure that workers get access to any labor rights and social protection benefits of any regular workers, because most of the time, and Mark mentioned it, we have like a two-tier workforce. I mean, domestic workers may not have access to the same social protection. They have a derogatory, they belong to a derogatory system. And that is something that we as social partners have to work all together to help to progress and to implement the reforms that are needed.
Thank you very much, Aurélie. Mark, did you have anything to add? I know that you are also, you mentioned again the differential treatment before of declared and undeclared workers. Do you have anything to add to what Aurélie was saying?
I think it's just picking up on a point that Stacey made before. I think if a person searches for care, usually there's two options: that you either go down the undeclared route, or that it effectively means that in the patriarchal society that we live in, that it means a daughter, a mother, or an aunt, or whatever woman is around will take time off work and will leave her job in order to care for a person within the family. And what we need to develop is a high road approach to both those families that want to keep care within their family, as well as those who effectively want to be cared for within their homes. And the big danger at the moment is that companies and services providers are moving into the space, and that the regulatory aspects and the collective bargaining structures and the industrial relation structures lag so far behind that in 15, 20 years, we'll have a complete Wild West, which we already have to some extent in that household home care services, and that there will be no way for unions to access it. And for us to develop decent and good jobs. So how do you take those women in particular who have cared for their loved ones? How do you make sure that they have some kind of qualification, some kind of training where they also come into contact with other people that are working in the formalized care sector? How do you make sure that the home care workers can move from home care into residential care settings and potentially even into hospitals, which pay higher wages, are much more male-dominated workplaces, etc.? And so I think that we need to look at care in terms of its whole life cycle and in a holistic way when we're thinking about policy proposals. And I think this is one of the astonishing things, and I'll end on this before other people can come in. 15 or 20 years ago, no one was mainstreaming the discussion on trade unions and labor rights in a discussion on care or on any kind of industry. If we want to make sure that this industry works for people and this sector works for the care users and for the care workers, unions will need to be central to that undertaking, because without a voice at work, it will just not be possible. Even if we have higher wages, we'll have huge fluctuation, huge labor shortages will continue to plague the sector. And so I'm very happy about the fact that we have that, but we also need to seize the moment and think, okay, what kind of tools can we develop concretely in order to make that a reality? And
there it's perfect, because I'm about to ask Stacy, what can we do concretely? So particularly, of course, for the group that you represent, so for family carers or informal carers, in the sense of what you mean, that is members of the family who care for their relatives in most cases while they are working. So can you tell us a bit about what you're doing concretely, and also possibly what's happening in various countries, what initiatives you're already seeing?
Thank you. Well, first of all, let me say I completely agree with Mark's analysis there. I would add to it that we also see a tendency nowadays to try and formalize informal carers, which is great, but at the expense of good quality professional care. So the idea now is not to create new rights and new support measures to targeted at informal carers at the expense of investment in good quality professional care. We believe that good quality professional care should remain the foundation of our care systems in Europe, and informal care should come on top of that. And yet there are, there are some concerning, let's say, trends that we are seeing in some member states, particularly I suppose as a byproduct of the care strategy, and the care strategy is very much welcome, don't get me wrong, but I mean, in terms of the transposition, we need to keep a close eye on this. So in my previous answer, I mentioned the need to provide support to those carers who combine work and care, but obviously there are millions of informal carers who are not in employment or who are not of working age, and these millions of carers also deserve, obviously, support and recognition. So on our side, what we're trying to do is, first of all, to document their situation and needs, to develop practical services and support measures across member states and across our network, targeted at them, so in the form of information and training. So at the moment, for example, we are collaborating with the Commission and WHO Europe on the development of an online information hub targeted at informal carers that would provide them with you know, very practical tips about what does it mean to be an informal carer, how can they maintain their own well-being, how potentially can they inform their employer, how should they interact with care professionals. So this is basic information that is really missing, you know, across Europe. So we're working on that. We are also trying to document the formulation of policy developments outside of the care sector, because obviously informal carers in the context of care obviously make sense. But informal care actually touches upon many different dimensions. Gender equality is one. There's a lot of young people and even kids involved in the provision of informal care, and these kids are completely invisible currently. The data collection process, so data we have at disposal, the official data, I mean, is, you know, could be improved, to say the least. So there are many aspects where we are trying to push and inform developments. So yeah, again, in fairness, a lot has happened in the last few years. We're seeing, you know, promising initiatives across Europe with, you know, some sort of a gradient. The Nordic countries and Western Europe is definitely more advanced than the rest, but hopefully that will change very soon. So yeah, I suppose we need to remain positive, and as Mark and Aurélie as well highlighted, we need to work together. I think that's really important as well, and probably coordinate a bit better in terms of our joint messaging around these important issues.
Thank you very much, Stacey. I'm getting to the last question for Youssef, so please, in the audience, if you have questions, post them in the chat and we'll ask our panelists. So Youssef, the floor back to you. You started the conversation. I'm ending it also with you, although I hope the conversation stays open after, of course, this webinar. So I mean, a lot of what we have highlighted, the examples that have come up and that the panelists have mentioned, that also Anna has mentioned in her presentation, come from developed countries, more developed countries, Western Europe, or developed countries outside Europe. But is this discussion also relevant, do you think, for developing countries? What are the lessons that may be valuable for them?
Yeah, no, certainly, and I think as I did mention earlier on when we started this conversation, that yes, I think some of the trends that have been observed in the developed world, like for example the aging population and also the changing in the family structures, which of course are behind some of the driving forces that led to the increase in the number of workers working in this sector. I think these driving forces are also at play, and will be at play in the future in the developing world. And this is what the ILO studies and the report have shown recently. And this question of care workers providing long-term home or institutional care have been, I think, on the agenda of the ILO, not as old as in June 2022, where the ILC discussion was discussed the issue of securing decent work for nursing personnel and domestic workers, key actors in the care economy. And clearly, it appeared from that discussion, but also from the report that the office prepared to inform that discussion, that yes, I think some of the transformations that the developed world and the development countries have experienced some decades ago are also now at play in the emerging and the developing countries. As mentioned, the population also is aging in some of these countries, and we are seeing in terms of statistics and looking at some indicators that fertility rates are also decreasing. Okay, so and also change in family structures that can be observed in both high income and also across the global south. So I expect that we expect that some erosion of availability of unpaid care work, okay, and therefore I think increased demand for paid care work, okay, in the developing world. And certainly, I think the findings, the very interesting findings from the study, I think will be interesting. I think for policymakers and the social partners also in the developing world to look at. Yeah? And we were mentioning the challenges in terms of the fact that not enough pay attention has been paid to this issue, to the conditions of the workers in this sector, in public policies, but also on social dialogue, and a lot need to be done. So obviously these questions would be also on the agenda of policymakers and the social partners in the developing world. And I think we can't underestimate the fact that these challenges, I think, will be growing in the future, and they require, I think, public policies. They require also social dialogue. It was a lot mentioned about collective bargaining, but for all that to happen, I think we need also political willingness and the appropriate institutions and frameworks. So, all this put together, there will be responses. And I think to avoid the kind of trend that we have been discussing, where this category of workers mentioned facing the poor working conditions, absences, and also a lot of accident, and also violence and aggression, and also undeclared and clear work. So all these challenges certainly would be also pertinent moving forward in the transformations that are facing also the countries on the other side.
Thank you very much, Youssef. Thank you very much for those points. I think we're getting to a Q&A part of our panel. While we see whether there are questions from the audience, I do have a couple of questions. So the first one is, I mean, we have gone through, the need for support, improving working conditions, wages, and so on. And Youssef has just mentioned it, reducing also stress, violence, addressing mental health issues at work. But if we look at the positive side, the long-term care sector is growing, right? So there are jobs there. If we manage to make them attractive, there are potentially very interesting careers there. Clearly, careers that have been held primarily by women so far, or foreign-born individuals. And so what can we do to increase this attractiveness? I think there were some elements already in some of your interventions. For example, we have talked about giving them career prospects, recognizing skills that have been acquired informally in some cases, or in any case in home care, for them to transition to better paid occupations or occupations in other sectors. We talked about training, for example. So I just wonder, what is your take of how we can make those jobs more attractive, particularly, we're gonna have also job losses on the other side, probably due to green transition, digitalization. And I know I know of relatively small projects where they have tried to transition workers. For example, they lost their jobs in the car sector in Australia into the fastest growing sector in the same region, which was the long-term care sector, with a lot of challenges, because it meant, convincing. It meant raising awareness of the opportunity, meant convincing a primarily male workforce to transition to jobs that were held primarily by women before. It meant convincing these people that they did have the skills, but they needed to build to address the skill gaps to transition. So, if we start seeing those jobs as an opportunity, what can we do to promote them? What can we do to make them more attractive? Is it appropriate to imagine that they can be also something that people move into voluntarily and transition into as a result of other mega trends that are affecting the labor market? Anybody wants to start? Stacey, yeah, go ahead.
Yeah, I'm happy to start for once. Yes, I agree with you. At least on paper, growing demand, I suppose, means a potential for a, let's say, market, if I can use that word, market growth in the care sector. But obviously, the key and the very difficult questions related to that is the question of financing. Who will pay for what and how? And that's the really thorny question. Because obviously the risk there is the risk that already Mark and Aurélie kind of touched upon. It's the risk of privatization, families having to try and look for solutions, online, which is already happening in many ways. And by the way, informal carers are probably one of the main clients because they're the ones trying to find, solutions. But obviously, in the short run, what we are interested in is the fact that, as Anna again highlighted, informal family carers are currently the main providers of long-term care. This is unlikely to change in the foreseeable future. And so we are talking about a workforce which in many cases, has not chosen to be involved in caregiving. People have become carers out of necessity rather than choice, and overnight in many cases. These people have extremely limited access to any type of support. So as a result, they face their own, long list of challenges: social exclusion, negative health outcomes, difficulty in accessing employment and education. They have practically no access to information or training as it stands, or when training is available, it's provided by NGOs with limited resources, our member organizations, so we know very well. And in many cases, they are unpaid, and when they have access to financial compensation, that compensation is tokenistic. So, yes, in the long run, there's potential, but in the meantime, there's a lot of very difficult questions to address, I think.
Thanks a lot, Stacey. I can tell my question was provocative enough because everybody wants to speak. So over to Aurélie.
Thank you, Glenda. So yeah, I mean, being a professional caregiver is a rewarding and meaningful job, but let's not forget that it's also difficult and demanding. And as employers, and what I can see from our members at national level, there is a lot of concrete things to be implemented to make the work more attractive. It goes, of course, the first thing we think of is wage increase, and that's I'm also. I mean, Stacey mentioned it, but there's a question of investment and public investment in the sector, because, of course, we need to have discussion with member states in order to see how we can really increase the wages of those workers. But there's also very specific things. How do we organize the working time? How do we reduce commuting from one home to the others? How do we pay travel time between two people? That's the concrete things that our members are trying to improve on a day-to-day basis. Professionalization is key, recognition of prior learning, but we should also be working and try to make it a viable career with a career perspective, also transitioning from also maybe another sector, but also within the sector. I mean, getting more skilled in the type of care you are providing, because you don't take care in the same way to a person with a very low dependency level for people with dementia. So this is also the question, and this is, I would say, the main topics our members are working on the ground on a day-to-day basis, trying to improve the situation in the most concrete way as possible.
Thank you, Aurélie. Excellent point, and also the progression within the sector. So, and over to Mark.
Just a few final words. In March this year, UniCare organized the high-level roundtable on labor shortages in the sector, and it effectively addresses the same question. And there was a very important points that was raised, and it was also mentioned by you, Glenda, like how do you actually get men to work in these jobs? And it's not only important in order to stem the labor shortages, but it's also important on a much more cultural level, because wherever men work, wages tend to rise. So what I would say is the following. We need to first and foremost think about how do we turn care jobs into kind of family sustaining jobs? Because if a person or if a family can live off of a person working in the care sector, then we've actually created a new economic paradigm in which care is valued as much as, you know, the car manufacturer, the car manufacturing is valued, because people and families can live off those jobs. And so I think it's a dual movement. One, on the one hand, a cultural, political, social movement in which we need to reattribute or revalue care, and on the other hand, we need to think about the hard economic facts, which Desi and Aurélie addressed in terms of public investment, etc. What I would say is, and I think this is the difficulty, that care jobs is not like standing at on a factory line, but you're also dealing with people. And I think this is where a lot of those schemes of turning car workers into care workers often fail, because they're kind of short-term solutionists, and they just think, oh, we'll take this group of 50-year-old men, put them into jobs in the care sector, and think that they will be able to cope. It's not that easy. I think people still have very much occupational pride in whether they're a car worker or a care worker. They identify with their jobs, and we need to effectively people want to care for one another in our society. People want to be there for their loved ones. People do want to have a greater mission than just to you know, do something for themselves. So care really taps into who we are as human beings, and I think that shouldn't be exploited in the way that it is being done at this moment, but it should be used for the benefit of the care worker and the care user in equal measure.
Very good point, absolutely, Mark. And over to you, Seppa, for your last word on this.
Okay. Well, let me, I wanted to contribute to the question you raised, Glenda, by referring to the ILO seminar report on care work and care jobs for the future of decent work in 2018, which revisited the triple R framework of recognizing, reducing, and redistributing unpaid care work, which inspired the SDG 5 target 5.4. The ILO added 2 R's to these 3 R's, recognizing, reducing, and redistributing unpaid care work. The ILO added 2 more R's, and it became recognize, reduce, and redistribute unpaid care work, reward paid work. So it means, you know, we need also decent wages by promoting more and decent work for care workers. And the fifth R is representation, social dialogue, and collective bargaining. So the 3R framework, you know, that inspired the SDG 5 targets 5.4 became 5 R's. So the ILO added 2, reward paid care work, and also giving voice and representation through social dialogue and collective bargaining to this category of workers. So if we want to make these jobs more attractive. Thank you.
Thank you very much, Youssef, and thanks, everybody. I think we're getting to the end of this webinar. So thank you to all the participants and to all the speakers. I think we have heard so much today. I don't want to start summarizing, but I think there is many very concrete ideas. We heard about, you know, the sectoral observatories. We've heard about the capacity building initiatives, also the information materials that Stacey mentioned for informal carers. We have heard about the transition to formality and several initiatives or examples of how that can be achieved. And we've also heard about, recognizing prior learning, about improving the working conditions in view of making the profession more attractive. Many thanks to everybody. I want to remind you again, there's another, there's a series of 4 webinars. This is only the first. The next one will take place on the 7th of November, and we'll present some work on human rights due diligence that we've done at Global DIA. So I'll see you again on the 7th of November. I hope register if you're interested, and spread the news about the webinar series among your institutions. Thank you very much again, everybody, and thank you to all the participants online. Many thanks.